Whether it's listening to their stories, learning from their lived experiences, or simply spending time in the kitchen, our grandparents guide us as pillars of understanding our culture. Come alongside us as we connect with Punjabi families in Surrey BC to learn how they honor their roots and create intergenerational connections. Today, we'll follow S.O.U.D.A, a youth-led organization doing Seva in the form of life-saving education on harm reduction and overdose prevention. Our grandparents' shadows. Sadesyananda Parashama.
Hello, Vaheguru Ji Ka Khalsa,
Vaheguru
Vaheguru Ji Ki Fateh.
Fateh.
Thank you so much for having us here and inviting us. My name is Gurkirat Singh and I'm founder of S.O.U.D.A, which stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada. So it's a student-run non-profit organization.
Hi, I'm Sandeep.
Hi everyone, my name is Karn.
Hi, I'm Anup Singh and I've been volunteering with S.O.U.D.A since 2020. So S.O.U.D.A, we go out into the community, and in Punjabi and English, we talk to different people of all ages, and we explain to them the signs and symptoms of drug overdose, and then we also explain to them how to do first aid and how to give them artificial breaths as well. But one of the things that I really enjoy in S.O.U.D.A is that we do naloxone training. So we train people of all ages in English and Punjabi how to use naloxone kits, and we give them out for free as well. And these kits, they can save people's lives who are on drug overdose, because every single day 5 to 10 people a day die due to drug overdose, and that's 180 a month. So that's the equivalent of a plane dropping in the ocean and dying that many people every single month. So with this training, you can save somebody's life. It reverses the drug overdose effects for about half an hour, and that's how long it takes for an ambulance to come, at least half an hour. So this is a very big issue in the community, and if you could just help people save their lives until an ambulance gets there and teach them harm reduction strategies and stuff like that, it's a big help in the community.
Yeah, so as Anup mentioned, the numbers have been rising since 2016. So in 2016, BC government declared health emergency in British Columbia pertaining to opioid crisis, which now is polysubstance crisis, not only opioid crisis. So in 2019, I would say in 2020 actually, Fraser Health released only report pertaining to South Asian community, that in South Asian community living in Surrey, Surrey, Burnaby, all the way till Hope, there has been 258% or more increase in opioid overdose related deaths and harms in South Asian community as compared to non-South Asians. We can clearly see that this number, or the devastation which opioid overdose has caused in recent years, it literally caused havoc in our South Asian community living in Surrey. And what we saw on ground, or what I hear from my friends or people at my work, that they knew almost like everyone knew someone in their family who was struggling through substance use. Kyunki jehdi afeem a, opium, it is a very well-known drug which has been used since ages in South Asian community, in Punjabi community particular. But the problem is, these days, or since 2016, opium has been laced with fentanyl in Canada. Fentanyl is 50 to 100 times more potent than heroin. So we can imagine when opium is laced with these toxic drugs, it can lead to higher number of overdose deaths. And that's what has been happening in our community. So we see seniors coming to us that, oh, we saw this news of 24-year-old guy dying with heart attack, or 19-year-old or 27-year-old healthy guy dying with heart attack. What is this happening? And most of the times, it is not heart attack itself, but it is death due to overdose. So we have seen all these stories in our community and during our outreach. So that's why the name S.O.U.D.A means to improve something. Punjabi de vich sodh karni kihi cheez, to improve something. So that's how the acronym works. So we are improving the situation in our community. And in addition to providing first aid and how to use naloxone and how to respond to an overdose, we help families to prevent an overdose by connecting them with mental health resources and culturally sensitive and language specific opioid agonist treatment centers such as Roshni Clinic in Surrey, and also providing counseling services with Moving Forward Family Services and South Asian Mental Health Alliance. So, so in around 2018, I was working at a gas station. I've worked as a gas station attendant for like 3 years. And one evening during my shift, I witnessed an overdose. So there was this homeless lady who walked into our gas station and she said she want to use the washroom. But after some time, like when I knocked the door, she was unresponsive. There was no response from inside. So I have to call 911 that someone is lying unconscious inside. So that was first time I was witnessing an overdose happening in front of my eyes. And I was clueless what to do in that situation. And I also remember in the beginning of 2016, health authorities, they were putting up some banners and some posters at our gas station that toxic drugs are circulating and people are dying. At that time, I was unsure, like, what is this? Because I never imagined that Canada would be, or British Columbia in particular, will be going through such crisis. So that was an eye-opening experience, like seeing someone overdosing in front of me and being helpless in that situation. So I had that seed somewhere in my brain to learn these skills and to do something for the community, because toxic drugs, they do not spare any community in particular. So if we are having toxic drugs on our streets, that means every community living in that area or geographic region will be impacted with that. So as time passed, I had an opportunity to attend a retreat which was hosted by South Asian Mental Health Alliance. And the founder of South Asian Mental Health Alliance, Mr. Kulpreet Singh, very good friend of mine and a mentor, I would say. And he contacted us that, okay, we are having this retreat where we are training 25 international students in various modules, overdose response and prevention, mental health first aid certification, suicide prevention, ending gang violence, or helping our youth to be productive rather than going into gangs and stuff like that. So that was a great opportunity, and I hopped on to that. I attended that retreat, which lasted for 3 days, and the amount of wealth of knowledge which we gained from that retreat was immense. So in that retreat, there was this small module on overdose response and prevention training hosted by our regional harm reduction coordinator, Aaron Gibson. So while I was doing that retreat, while I was doing that module where we were literally practicing how to use a naloxone kit in a case of an overdose, I was like, no one is doing this in my own community and in Punjabi. So that was like I had that vision, maybe starting something like this at different places of worship, community parks, and with like student organizations, so that we can train our people in our own language and with our own skills and own particular way, so that when people come across the same situation which I came across like few years ago at a gas station, they can feel more confident and they can save a life. So that's how it all got started. And then ਜਿਵੇਂ ਆਪਾਂ ਪੰਜਾਬੀ ਚ ਕਹਿ ਦਿੰਦੇ ਆ ਕਾਫਲਾ ਬੰਦ ਆ ਗਿਆ, ਲੋਕ ਆਉਂਦੇ ਗਏ, and then we started having like a executive body, and then we got registered, and we got as a registered non-profit organization. Where like we started going into conferences, and then I was seeing lack of research pertaining to substance use patterns in South Asian, particularly Punjabi community. So we started doing some cool research on international students. So I collaborated with Dr. Natasha Puri from Roshni Clinic, and we were having like these qualitative and quantitative interviews so that we can bring something to our academic literature where we can present these statistics and data for developing policies and developing interventions for our Punjabi youth and South Asian youth who are using substances, and they should be treated with respect and dignity when they go and see some healthcare provider. So since last 5 years, so they have been doing like immense amount of work, and all this is again no one is working for a paycheck. Everyone is doing Seva. Everyone, all of our volunteers, they're so dedicated. And whatever we have today and whatever we have done for our community today, uh, all that credit goes back to all our hardworking volunteers.
So Seva, definition of Seva is selfless service. So to help another person without wanting anything in return, to truly see that Vaiguruji is in every single person, irrespective of their gender, their religion, of anything, and just wanting to help people, just to want to help them because you feel so much compassion and love and kindness towards all living beings. And so that's what Seva is. And through S.O.U.D.A, we help people by raising awareness, educating people that that's a Seva. If you share knowledge that you have that others don't have, just how we do naloxone training, and we give out free kits as well. And all of these are examples of how we do Seva. And also S.O.U.D.A, it encompasses all the different types of Seva. We give our time through Seva. We have people in S.O.U.D.A who help through their money. We have people who do Seva through giving time, money, and physically coming in person and talking to people. So all three types: tan, mana, tan, body, mind, and wealth, and time. So it encompasses all the different types of Seva as well in our organization.
Since my early childhood, I have been very close to my grandma, and she introduced me to the concept of Seva. So I am from Shri Amritsar Sahib, the holy city, and I remember going to Shri Harmandir Sahib and Gurdwara Shaheed Ganj Sahib and doing Seva over there. And one thing which I really admire about Seva is you're doing something for others without having any thought or intention of getting something in return. So the Seva which our volunteers and which we are doing at the grassroots level, we are not doing that for any recognition or for for any personal gains, but the entire idea is there is a need which has to be filled. And the way we are doing this at the gurdwaras, it actually reminds us that okay, so we have to stay consistent, we have to be there to save lives, because saving a young life is a big thing, because young people are dying all the way from 18 to 45, and if we are not doing this, then the overdose crisis could wipe out our entire generation. So I think that is really huge. So doing this life-saving skills and this work which we are doing right now is something which not only providing us with sense of gratitude towards our community, which has given us everything, but also it's our moral responsibility to be out there and to do something in return for the community. Because when I came to Canada in 2015, I have received everything from my community. I have eaten langar at Gurdwara Sahib, I have attended those spiritual sessions at Gurdwara Sahib. And if I know something where I could be a beneficial, then I think that's really important for me to give back something in return, not only, that consumer mindset. So I think giving something in return is really huge. And also in Sikhi, Maharaj say, in Guru Granth Sahib, which duniya sev kamaiye, ta dargah baisan paiye. So one day I will be dead. So I have to show my face to Vaheguruji. So this is, Seva is not a choice, but I think it's a hukam. It's an order of Guru Granth Sahib that if you call yourself a Sikh, then you have some responsibilities towards your qawm, towards your community. And the best way to do that is through Seva. And in Sikhism, we had great Gur Sikhs who we look upon to. For example, Bhagat Puran Singh Ji, he spent his entire life for doing service for people who had disabilities, people who cannot speak, people who cannot walk and talk. So Bhagat Puran Singh Ji is a big inspiration for all volunteers, the work he did for humanity. I think those Gursikhs, they are the driving force behind our work.
Just last week when we were with you guys at the Gurdwara, we saw you talking to a group of 20 seniors.
Yeah.
So what is your experience now in 2024 talking with 20 seniors when you started S.O.U.D.A?
Yeah. So definitely as time passed, we have seen that community has become more receptive towards what we are what we're providing at our booths. So I can share another example. So like in 2019, people were actually hesitant to receive naloxones from us, even though they would know someone, or they would be like, should I take it or should I not? We can see like their facial expressions that like they want to, but there is this stigma factor which is stopping them. But as time progressed, as our volunteers, they consistently did booths every month, even through pandemic, when people were afraid to like go out in public gatherings. Our volunteers were working on ground at grassroots level, providing naloxone trainings. So I think the impact of those consistent outreach booths is that today we see seniors who come to us and they're like, oh, I already used your naloxone kit at my work or at my home. Can I get another one? So I think that's a huge success we have. That people, they are now, the stigma which used to be there is now eradicating, and now we are having a more positive relationship with the congregation, with community, so that they can trust us.
So during the COVID-19 pandemic, there was increased social isolation because of various restrictions imposed and things like social distancing. COVID-19 was the time when youth in particular experienced more isolation than before because of these restrictions. I believe that maybe some seniors who used to experience things like language barriers, their isolation began when they first landed on Canadian soil. So for those individuals, the isolation increased during the COVID-19 pandemic because of the restrictions. And to keep that connection going with my community, we make use of various outlets that are out there. We not only do our outreach through in-person booths, but we also make educational videos which we upload on our social media platforms. And other than that, we collaborate with other organizations like One Voice Canada and South Asian Mental Health Alliance.
I can imagine during COVID that obviously, like you mentioned, the opioid crisis got more. So the need of naloxone didn't go down. So how are you able to provide that still to the people in your network?
We did home delivery of naloxone kits. So the volunteers of S.O.U.D.A, we delivered these naloxone kits to people living in their homes, and we also trained them on how to inject naloxone. So that was really effective. And other than that, we also had some Zoom sessions on naloxone training, where we trained many individuals on how to inject naloxone as well.
I would like to speak this in Punjabi.
Yes, go ahead.
Because this is highly personal
Yeah.
to the community. ਸੋ ਇੱਦਾਂ ਹੁੰਦਾ ਵਾ ਕਿ ਜਦੋਂ ਅਸੀਂ ਬੂਥ ਲਾਉਂਦੇ ਹੈਗੇ ਆ, ਉੱਥੇ ਬਹੁਤ ਵਾਰੀ ਸਾਨੂੰ ਮਾਵਾਂ ਮਿਲਦੀਆਂ ਵਾ ਜਿਨ੍ਹਾਂ ਦੀ ਉਮਰ ਅਰਾਊਂਡ 60 ਸਾਲ ਜਾਂ ਮਤਲਬ ਕਿ 50 ਤੋਂ ਉੱਤੇ ਹੁੰਦੀ ਆ। ਅਤੇ ਬਹੁਤ ਵਾਰੀ ਇਹ ਵੇਖਿਆ ਗਿਆ ਵਾ ਕਿ ਜਦੋਂ ਕੋਈ ਵੀ ਨੌਜਵਾਨ ਸਬਸਟੈਂਸ ਯੂਜ਼ ਸ਼ੁਰੂ ਕਰ ਲੈਂਦਾ ਹੈਗਾ ਵਾ, ਜਾਂ ਮਤਲਬ ਕਿ ਉਹ ਨਸ਼ੇ ਦਾ ਆਦੀ ਹੋ ਜਾਂਦਾ ਵਾ, ਉਦੋਂ ਕੀ ਹੁੰਦਾ ਕਿ ਸਾਰੇ ਜਾਣੇ ਉਹਦੇ ਤੋਂ ਪੱਲਾ ਝਾੜ ਲੈਂਦੇ ਆ। He gets so isolated and alone, but there is only this one person who never gives up on this guy, ਤੇ ਉਹ ਹੁੰਦੀ ਉਹਦੀ ਮਾਂ। ਸੋ ਜਿਹੜੀਆਂ ਮਾਵਾਂ ਵਾ ਉਹਨਾਂ ਦੇ ਹਿਰਦੇ ਬਹੁਤ ਕੋਮਲ ਹੁੰਦੇ ਹੈਗੇ ਆ, ਅਤੇ ਜਦੋਂ ਅਸੀਂ ਇੱਦਾਂ ਉਹਨਾਂ ਮਾਵਾਂ ਨਾਲ ਗੱਲ ਕਰਦੇ ਹਾਂ, ਉਹ ਆਪਣਾ ਜਦੋਂ ਦੁੱਖ ਰੋਂਦੀਆਂ ਸਾਡੇ ਅੱਗੇ, ਉਹ ਕਹਿੰਦੀਆਂ ਕਿ ਮੇਰਾ ਪੁੱਤ ਪਿਛਲੇ 14 ਸਾਲਾਂ ਤੋਂ, ਕੋਈ ਪਿਛਲੇ 20 ਸਾਲਾਂ ਤੋਂ ਇੱਦਾਂ ਮਤਲਬ ਕਿ ਨਸ਼ੇ ਨੇ ਮਾਰਤਾ ਵਾ, ਨਸ਼ੇ ਦੀ ਲੱਤ ਉਹਨੂੰ ਲੱਗੀ ਹੋਈ ਆ, ਅਤੇ ਉਹਦਾ ਇਲਾਜ ਮੈਂ ਕਿੱਥੋਂ ਕਰਾਵਾਂ, ਉਹਨੂੰ ਮੈਂ ਕਿੱਦਾਂ ਸਮਝਾਵਾਂ, ਉਹਨੂੰ ਮਤਲਬ ਕਿ ਮੈਂ ਕਿੱਦਾਂ ਚੇਂਜ ਕਰਾਂ ਕਿ ਕਿਸੇ ਤਰੀਕੇ ਨਾਲ ਉਹ ਮੰਨ ਜੇ ਕਿ ਮੈਂ ਡਾਕਟਰ ਕੋਲ ਚੱਲ ਜਾਂ ਮਤਲਬ ਕਿ ਕੋਈ ਦਵਾਈ ਸ਼ੁਰੂ ਕਰ ਲਈਏ, ਕਿਉਂਕਿ ਉਹਨਾਂ ਬੰਦਿਆਂ ਦੇ ਡਿਵੋਰਸ ਹੋ ਚੁੱਕੇ ਆ, ਉਹਨਾਂ ਵਿਚਾਰਿਆਂ ਦੇ ਘਰ ਜਿਹੜੇ ਤਬਾਹ ਹੋ ਚੁੱਕੇ ਆ, ਹੈ ਨਾ। ਸੋ ਉਹ ਜਿਹੜੀਆਂ ਮਾਵਾਂ ਦਾ ਜਿਹੜਾ ਦਰਦ ਹੁੰਦਾ ਵਾ, ਉਹ ਬੜਾ ਮਤਲਬ ਕਿ ਸਾਨੂੰ ਝੰਜੋੜਦਾ ਅੰਦਰੋਂ। ਇਟ ਲਿਟਰਲੀ ਸ਼ੇਕਸ ਆਵਰ ਸੋਲ ਦੈਟ ਨੋ, ਲਾਈਕ ਦਿਸ ਇਜ਼ ਰੀਅਲੀ ਸੀਰੀਅਸ ਕਾਜ਼, ਕਿ ਜੋ ਅਸੀਂ ਕੰਮ ਕਰਦੇ ਪਏ ਹਾਂ ਇਹ ਬਹੁਤ ਜ਼ਰੂਰੀ ਆ, ਅਤੇ ਇਹਨੂੰ ਅਸੀਂ ਚੱਲਦਾ ਰੱਖੀਏ। ਸੋ ਜਿਵੇਂ ਇੱਕ ਮਾਤਾ ਜੀ ਸਾਨੂੰ ਮਿਲੇ ਸੀਗੇ, ਉਹ ਕਹਿੰਦੇ ਕਿ ਪੁੱਤ ਮੈਂ ਆਪ ਕੰਮ ਕਰਦੀ ਹਾਂ, ਐਂਡ ਹਰ ਏਜ is around 65 to 70, and she's working, even though that's the typical age of retirement in Canada, but she has to work because her son is going through really problematic opioid use disorder, and he disappears from their house for like 7 days and not returning until the 10th day. And she is like, just imagine, or just let's get into the shoes of that lady who don't know where her son is for an entire week. And then ਜਦੋਂ ਵੀ ਉਹ ਮੁੰਡਾ ਘਰੇ ਆਉਂਦਾ ਵਾਪਸ, ਜਾਂ ਤੇ ਉਹਦੇ ਸੱਟ ਲੱਗੀ ਹੁੰਦੀ ਆ, ਜਾਂ ਉਹਦੀ ਅੱਖ ਪਾਟੀ ਹੁੰਦੀ ਆ, ਜਾਂ ਉਹ ਆ ਕੇ ਓਵਰਡੋਜ਼ ਹੋ ਜਾਂਦਾ ਹੈਗਾ ਵਾ, ਤੇ ਉਦੋਂ then all that burden of substance use is literally carried over to that lady. ਸੋ ਉਹ ਮਾਵਾਂ ਨੂੰ ਕਦੀ ਸਪੇਸ ਹੀ ਨਹੀਂ ਮਿਲਦੀ ਕਿਤੇ ਜਾ ਕੇ ਉਹ ਆਪਣੀ ਗੱਲ ਰੱਖ ਸਕਣ, ਕਿਤੇ ਜਾ ਕੇ ਉਹ ਆਪਣੀ ਗੱਲ ਸ਼ੇਅਰ ਕਰ ਸਕਣ. ਸੋ ਜਦੋਂ ਸਾਡੇ ਬੂਥ ਤੇ ਆਉਂਦੀਆਂ ਵਾ, we provide them safe space where they can share their concerns, their problems at home, and also then finally we discuss some problem solving and solutions. ਕਿ ਮਾਤਾ ਜੀ, ਤੁਹਾਡਾ ਜਿਹੜਾ ਪੁੱਤਰ ਹੈ ਨਾ, ਉਹਦੀ ਇਨਕਮ ਲੱਗ ਸਕਦੀ ਆ, ਤੁਹਾਡਾ ਜਿਹੜਾ ਪੁੱਤਰ ਆ ਉਹਦੇ ਕੋਲ MSP ਹੈਗੀ ਆ, ਆਪਾਂ ਉਹਨੂੰ ਰੋਸ਼ਨੀ ਕਲੀਨਿਕ ਭੇਜ ਕੇ ਉਹਦੀ ਓਪੀਓਇਡ ਐਗਨਿਸਟ ਥੈਰੇਪੀ ਜਿਹੜੀ ਹੁੰਦੀ, ਨਾਲ ਅਸੀਂ ਉਹ ਵੀ ਸਮਝਾਉਂਦੇ ਹਾਂ ਕਿੱਦਾਂ ਦਵਾਈ ਕੰਮ ਕਰਦੀ, ਕਿ ਉਹ ਦਵਾਈ ਆਪਾਂ ਉਹਨੂੰ ਦੇ ਕੇ ਸਟੇਬਲ ਕਰ ਸਕਦੇ ਹਾਂ, ਜਾਂ ਜੇ ਉਹਨੇ ਰਿਕਵਰੀ ਹੋਮ 'ਚ ਜਾਣਾ, ਆਪਾਂ ਉਹਦੀ ਅਰਜੀ ਭਰ ਸਕਦੇ ਹਾਂ. ਸੋ ਉਹਦੇ ਨਾਲ ਕੀ ਹੁੰਦਾ ਕਿ ਜਿਹੜੀਆਂ ਮਾਵਾਂ ਹੁੰਦੀਆਂ ਵਾ, ਜਿਹੜੀਆਂ ਵਿਚਾਰੀਆਂ ਕੱਲੀਆਂ ਆਪਣੇ ਮਤਲਬ ਘਰ ਦੇ ਵਿੱਚ ਝੂਰਦੀਆਂ ਰਹਿੰਦੀਆਂ ਵਾ, ਉਹਨਾਂ ਨੂੰ ਉਹਨਾਂ ਦੇ ਅੰਦਰ ਇੱਕ ਆਸ ਜਾਗ ਜਾਂਦੀ ਕਿ ਸ਼ਾਇਦ ਮੇਰਾ ਪੁੱਤ ਠੀਕ ਹੋ ਜਾਊਗਾ, ਜਾਂ ਐਟਲੀਸਟ ਮੇਰੀ ਕਿਸੇ ਨੇ ਗੱਲ ਸੁਣੀ ਅੱਜ. ਸੋ ਆਈ ਥਿੰਕ ਇਹ ਬਹੁਤ ਜ਼ਰੂਰੀ ਚੀਜ਼ ਹੈ. ਦਿਸ ਇਜ਼ ਰੀਅਲੀ ਇੰਪੋਰਟੈਂਟ ਬਿਕੋਜ਼ ਵੀ ਹੈਵ ਲਾਈਕ ਸੋ ਮੈਨੀ other places, safe spaces for other communities where all these moms whose sons either died by overdose or they're struggling with substance use, they have those safe spaces where they can talk about this stuff. But in our Punjabi community, due to stigma, we have very limited of those. And I think S.O.U.D.A outreach booths, that is a safe space, and that is a mobile safe space which literally moves from place to place. So we are not waiting that people come to us, we're actually going to the people. As they say, hard to reach populations. No, they're hardly reached populations. So there are people out there who are waiting for us to go there and to listen their emotions, to listen their concerns, because at the end of the day they have no one in Canada, because ਉਹ ਇਕੱਲੇ ਘਰ 'ਚ ਬੰਦ ਰਹਿੰਦੇ ਹੈਗੇ ਆ. ਜਦੋਂ ਗੁਰਦੁਆਰੇ ਆਉਂਦੇ, ਨਾਲੇ ਤੋਂ ਮੱਥਾ ਟੇਕ ਲੈਂਦੇ ਹੈਗੇ ਆ, ਤੇ ਨਾਲੇ ਉਹ ਆਪਣਾ ਦੁੱਖ ਸੁੱਖ ਸਾਡੇ ਨਾਲ ਫਰੋਲ ਲੈਂਦੇ ਆ, ਤੇ ਉਹਨਾਂ ਨੂੰ ਫਿਰ ਅਸੀਂ ਰਿਸੋਰਸਿਸ ਪ੍ਰੋਵਾਈਡ ਕਰ ਦਿੰਦੇ ਆ.
And that's the beauty of your organization too, is that the Gurdwara is the safe space.
Yes.
And so essentially you are, like you said, it's a mobile organization. You can bring it to them.
Yeah.
And I think another big thing to note as well is that mom, she would have never had any support.
No.
Because she wouldn't know where to go. So I think having your organization in the Gurdwaras, it's like it brought a light into her life.
Yes, exactly. ਇੱਦਾਂ ਹੀ ਹੁਣ ਰੀਸੈਂਟਲੀ ਮੇਰੀ ਉਹਨਾਂ ਨਾਲ ਗੱਲ ਹੋਈ ਸੀਗੀ, ਤੇ ਉਹ ਕਹਿੰਦੇ ਆ ਕਿ ਮੈਂ ਆਪ ਨਲੋਕਸੋਨ ਯੂਜ਼ ਕਰਕੇ ਆਪਣੇ ਪੁੱਤ ਦੀ ਜਾਨ ਬਚਾਈ ਆ, ਜਿਹੜੀ ਨਲੋਕਸੋਨ ਮੈਂ ਤੁਹਾਡੇ ਕੋਲੋਂ ਲਈ ਸੀਗੀ. ਸੋ ਆਈ ਥਿੰਕ ਲਾਈਕ ਦੈਟਸ ਅ ਸਕਸੈਸ ਸਟੋਰੀ ਕਿ ਵੀ ਸੇਵ ਦੀਜ਼ ਲਾਈਵਸ. ਕਿ ਜੇ ਹੁਣ ਉਹਨਾਂ, ਕਿਉਂਕਿ ਜਿਹੜੀ ਡਰੱਗ ਆ ਉਹ ਘਰੋਂ ਘਰੀ ਵਿਕਦੀ ਆ, ਸੋ ਇਟਸ ਲਾਈਕ ਵੀ ਕੈਨ ਗੈਟ drug delivery at our footstep, at our doorsteps, with more ease as compared to pizza or ambulance. So the health services, they are not operating at the same level the illicit market or illicit drug supply market is working. So unless or until we match the frequency and vibe of illicit market, we can never defeat drug toxicity in Canada. So we have to be at the same level. We have to provide naloxone kits at the doorsteps. We have to provide OAT, or we have to provide Suboxone and all these treatments for people who are suffering with substance use at their doorstep, not waiting them to travel for 1 hour to get the medication, or to have insurance or particular immigration status to get that life-saving medication. So we have lots of positive stories, but sometimes we do have really difficult conversations as well. For example, I remember when we had our first booth in September 2019, we were hearing some mixed emotions from people. Some people were like, oh, you're talking about drugs and you're talking about this new concept you're framing, harm reduction in the Gurdwara. So sometimes people who have like really difficult experience within their families, they become like numb, or seeing someone providing harm reduction or naloxone training could be a trigger for them, because they have used this somewhere. Maybe, for example, I can share a story of an uncle who were like really really angry at us, and he was like, why are you doing this? People who use drugs, you should just literally give up on them, because they will never be cured, or they will never be sober again, because his brother had really difficult time and then he died. So all that training and all those conversations were bringing him trauma. So we do have difficult conversations, because harm reduction is something new in our community. But again, like, it's the principles of Sikhi, the principles which like keeps us reminding why we are standing here on a Sunday evening when we can do so many other things. Why all these volunteers are gathered here? Because we care for our community. And if ਆਪਾਂ ਨਹੀਂ ਕਰਾਂਗੇ ਤੇ ਕੌਣ ਕਰੂਗਾ? ਕਿਉਂਕਿ ਜੇ ਆਪਣੇ ਭਰਾ ਬਿਮਾਰ ਆ ਤੇ ਆਪਾਂ ਨੂੰ ਹੀ ਠੀਕ ਕਰਨਾ ਪੈਣਾ। ਆਪਾਂ ਦੂਜੀਆਂ ਕਮਿਊਨਿਟੀਆਂ ਵੱਲ ਨਹੀਂ ਵੇਖ ਸਕਦੇ ਕਿ ਉਹ ਦੇ ਵਿਲ like appear on our gurdwaras and they will start teaching our brothers. No. So it is our brothers, our responsibility. And that's actually the driving force behind S.O.U.D.A. In Guru Granth Sahib, there is this pankti, Vidya vichari ta paryupkari. So all our education, like all our volunteers, they're going to universities, colleges, they're well educated. So ਸਾਡੀ ਪੜ੍ਹਾਈ ਦਾ ਤਾਂ ਹੀ ਫਾਇਦਾ ਵਾ ਜੇ ਅਸੀਂ ਆਪਣੀ ਕੌਮ ਦਾ ਭਲਾ ਕਰ ਸਕਦੇ ਹਾਂ, ਜਾਂ ਜੇ ਅਸੀਂ ਆਪਣੇ ਭਰਾਵਾਂ ਦੀ ਦੇਖ ਰੇਖ ਕਰ ਸਕਦੇ ਹਾਂ। ਸੋ ਦੈਟਸ ਐਨ entire idea behind S.O.U.D.A. Like using all our pharmacology knowledge or biology knowledge. For example, when we explain people how the naloxone works, that's the pharmacology. And the way we designed our intervention is like very simple language. ਬਹੁਤ ਸਰਲ ਜੀ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਅਸੀਂ ਸਮਝਾ ਦਿੰਦੇ ਹੈਗੇ ਕਿ ਨਲੋਕਸੋਨ ਕਿੱਦਾਂ ਬੋਡੀ ਦੇ ਉੱਤੇ ਕੰਮ ਕਰਦੀ ਹੈਗੀ ਆ। ਸੋ ਇਹਦੇ ਨਾਲ one more aspect which is really crucial is sometimes during conversations we have to maintain our composure. Our volunteers, they respect everyone, but at the same time we also do some boundary settings. If we have a disturbing particle who is ruining the vibe, or who is literally trying to be aggressive, or they could be like verbally aggressive, then Gurdwara committees, they support us and they are aware that we are doing this life-saving work, and they're always there to help us. So yes, we do have a lot of positive experiences, but sometimes there could be some negative experiences as well, which our team members deal with them professionally.
After our S.O.U.D.A. booths, we go upstairs to the Darbar in the Gurdwara Sahib. We have Maharaji's Darshan, and we listen to some Kirtan, some Katha. Then afterwards, we have Langar together. And then afterwards, even in the parking lot, we end up talking a lot with each other. So we get a lot of social aspect, and we also get the spiritual aspect as well. Like the S.O.U.D.A. team is very close-knit. So we do a lot of socializing afterwards. So I think that is a big part of our self-care.
Yeah, so exactly, I really love like langar with everyone after our booth. So we sit there, we do Maharaji's darshan, and we seek blessings from Guru Granth Sahib. ਤੇ ਇੱਕ ਚੀਜ਼ ਹੋਰ ਆ, ਜਿਵੇਂ ਆਪਣੇ ਪੰਜਾਬੀ ਕਮਿਊਨਿਟੀ 'ਚ ਇਹ ਦੱਸਿਆ ਕਿ ਮਾਂ ਜਿਹੜੀ ਹੁੰਦੀ ਰੱਬ ਦਾ ਰੂਪ ਹੁੰਦਾ ਵਾ। ਸੋ ਜਦੋਂ ਕੋਈ ਵੀ ਮਾਂ ਸਾਨੂੰ ਮਤਲਬ ਕਿ ਇੱਦਾਂ ਕਹਿੰਦੀ ਹੈ ਕਿ ਪੁੱਤ ਤੁਹਾਡੇ ਕਰਕੇ ਹੈ ਨਾ ਮੇਰੀ ਕਿਸੇ ਨੇ ਸੁਣ ਲਈ, ਜਾਂ ਮੇਰੇ ਪੁੱਤ ਦੀ ਜਾਨ ਬਚ ਗਈ। ਸੋ all those blessings from those mothers, they actually keep us move forward. And I would say like all these community blessings, Guru Granth Sahib's blessings, and all these mothers' blessings, so they are actually the driving force behind the S.O.U.D.A. and ultimately all the dedication of our volunteers.
Working with S.O.U.D.A. has overall been a really positive experience. I'm really glad that I was able to use all my knowledge from my undergraduate courses that I took, and my communication skills in Punjabi, Hindi, and other South Asian languages in educating our community members about things that are important, like symptoms of drug overdose and how to give first aid when faced with an opioid overdose. And regarding my education, for example, I'm currently pursuing a Master of Science degree in math at UBC, and my research project is on compartmental models for opioid use disorder. And that's another thing that I feel really happy about, that I'm able to apply all of my experiences that I gained while reaching out to community members and various educational experiences in doing research in the same field. And in future, I want to be able to speak about my results that I get from my research and communicate them with seniors and other community members in Punjabi, Hindi, and other languages.
For me, the experience with S.O.U.D.A has been amazing. I think it's one of the best things I ever joined, and I'm glad that I did. I have like a little bit about me. Like I want to pursue something in healthcare, potentially be a physician. So I'm going to be working with these communities and getting this experience from S.O.U.D.A, be interacting directly with people that are struggling with mental health challenges, with drug addiction, and even other things that they're going through. And a lot of health challenges, and they often approach us. So these experiences have really helped me to be that culturally relevant and culturally competent caregiver that I want to be in the future. So that's one of my biggest things. And I also have my background in language has been a big factor in me pursuing being involved and just being with S.O.U.D.A for this long. When you hear the stories from the seniors, they really touch your heart, and I think that's and they're also very relatable too, because we live in big families, and we know that we've all been through some sort of mental health challenge. We all know somebody with addiction or something, and just hearing that you can do something about it by educating some part of the community, that because we have this wealth of knowledge when we go to these universities like UBC, SFU, we're all students from there, and we have this wealth of knowledge. Just being able to share that with other people, and the response you get from others when they say like, "Oh, you actually care about us, and you're willing to make our health better," it really touches you. And I think that's the reason I would say like my experience has been great because of that. Seniors go through so much in their life, and then all of a sudden it's a big culture shock for them when they come here. So having to go through that, and even having their kids go through some of these things, they want to help, they want to know about this stuff. So just being there for them I think it's really important.
Since 2019, all of the work which has been done in S.O.U.D.A is like complete dedication of volunteers. So we do not have any monetary support from either City of Surrey or British Columbia government or any health authorities. We do get literature, brochures, and life-saving naloxone kits from Fraser Health and BC Centre of Disease Control, which they provided to all organizations working with harm reduction. But in terms of monetary support, mostly it's out of our own pocket. The concept of this one in Sikhi. And secondly, we get some monetary support from South Asian Mental Health Alliance. Kulpreet Singh, as I mentioned, he's like our big brother and mentor. So we have our advisory committee where I would say leaders like Kulpreet Singh and Dupinder Kaur Saran guide us whenever we feel stuck or whenever we have a new idea and we have to move it forward. Other than that, since last 1 year, we have a peer with lived experience, Parvinder Singh. He had a really resilient journey, I would say, who came to Canada as an international student, and then he actually go through this opioid use disorder, and now he is sober from opioid use disorder, and now he's helping others how to do recovery effectively. And we are learning a lot from Parvinder. So he is guiding us when it comes to interact with people who use substances or homeless populations. So we have a very diverse team of individuals, and since last 5 years, this entire project or this entire organization, if it is existing today and consistently, it is only due to the dedication of our volunteers. Whether they volunteered for 1 hour or whether they are staying with us throughout last 5 years, I'm really grateful for their impact, and I'm really happy that I never actually thought that S.O.U.D.A will go this far in the beginning, because I never had a plan to do something like this. But this was like ਜਿਵੇਂ ਲੋੜ ਕਾਢ ਦੀ ਮਾਂ ਹੁੰਦੀ ਆ. In Punjabi they have this proverb which means like necessity drives innovation. So again, like all these like-minded people, they came together, and that's how we're making impact in the community, and that's how we're going to keep making this impact even in coming years with Maharaj Guru Granth Sahib Ji's Kirpa.
So if somebody is watching this today, how should they reach you if they need help? Like,
how can they find you guys?
First of all, we are at most gurdwaras in Surrey, so you can see our booth, come visit us, very welcoming. Other than that, you can contact us via email, or you can contact us on our Twitter handle or Instagram handle. In case people who do not use social media, they can go to the nearby gurdwara, and then they can like have information from Guru Nanak Sikh Gurdwara that ਜਿਹੜੇ ਸੋਧਾ ਵਾਲੇ ਹੁੰਦੇ ਹੈਗੇ ਆ ਉਹਨਾਂ ਦਾ ਸਾਡਾ ਨੰਬਰ ਦੇ ਦਿਓ, and the Gurdwara can help you to connect with us.